Dear Dr. Smith, new paragraph. I had the pleasure of seeing your patient today in the cardiology faculty practice for follow-up, period. She is a delightful 60-year-old woman who is status post-liver transplant for hepatocellular cancer following hepatitis C, period. During her hospitalization for the liver transplant, she was noted to be in atrial flutter, period. There was no evidence of ischemia, period. This was treated with IV amiodarone, and she was seen by the electrophysiology service who recommended PO amiodarone for 1 month and then discontinuation, as well as aspirin for 1 month and then discontinuation, period. She is here today for this follow-up, period. She has had no palpitations, no chest pain, and no shortness of breath, period. She looks great and says she feels great after her successful liver transplant, period. She has no history of heart disease, no rheumatic fever, period. She does get short of breath when she walks up a slight hill, period. She does not have to walk slower than other people of her age because of breathlessness, period. Her past history is notable for her liver transplant and hepatocellular carcinoma, period. The transplant date was June 8, 2009, period. New paragraph. Her current medications, which I have reviewed with her, are new line, numeral 1, period, metoprolol 75 milligrams twice per day, period, new line, numeral 2, period, prednisone 5 milligrams per day, period, new line, numeral 3, period, Cellcept 1000 milligrams, period, new line, numeral 4, period, tacrolimus, period, new line, numeral 5, period, Septra 3 times per week, period, new line, numeral 6, period, Valsite, period, new line, numeral 7, period, omeprazole 40 milligrams, period, new line, numeral 8, period, aspirin 81 milligrams, period, new line, numeral 9, period, amiodarone 400 milligrams, period, new paragraph. She is single, period, she lives alone, period, she is a former home inspector, period, she retired 2 years ago due to liver cancer, period, she is a former smoker, period, she quit 20 years ago, period, she uses alcohol occasionally, period, she has no sleeping problems, period. Her review of systems shows that her energy is decreased, period. She has a poor appetite, period. She has blurred vision, period. Her last tuberculosis test was a year ago, period. Last pap smear was last week, period. She has no joint or muscle problems, period. The remainder of the 13-point review of systems was negative in detail as in clinic chart, period. On examination, she is a thin woman in no distress, period. She has a bandage over her right cheek and a bruise underneath it, period. Her blood pressure today is 116/70, pulse 61 and regular, weight 108.4, period. HEENT shows pupils are equal, round and reactive, period. Mucous membranes are moist, period. No thyromegaly, period, no lymphadenopathy, period, jugular venous pressure is 6 to 7 centimeters, period. Chest is clear, period, she has no murmurs, rubs or gallops, period, her extremities show no clubbing, cyanosis or edema, period, her skin has normal turgor and is warm, period, distal pulses are 2+ and symmetric, period. Her EKG today, which I have personally reviewed, shows normal sinus rhythm, left axis deviation, period. She also had an echocardiogram on June 16, 2009, which I have personally reviewed, period. At that time, she was in atrial fibrillation, period. She had a normal biventricular size and function and no significant valvular disease, period. It was an unremarkable study, period. New paragraph. Impression and plan, post-operative atrial flutter, now resolved, period. She should certainly stop the amiodarone and stop the aspirin, period. She also does not need to take the metoprolol, period. She tells me she was not taking it for hypertension, but for rate control, period. She remains in sinus rhythm, and I do not expect any recurrence of the atrial flutter, period. I have not made a follow-up appointment, but would be happy to see her again on a PRN basis, period. Meanwhile, I have advised her to stop the cardiac medications and to resume full activities from a cardiac perspective, period. She will follow up with the liver transplant service, period. New paragraph. Sincerely, new line, Dr. Redberg, period.